right. So, dear future healthcare experts, the Merck Foundation alumni, distinguished media partners, and winners of the Merck Foundation Awards of Namibia. It is a great pleasure for my colleagues and myself to be here today. For me, and specifically, because the first time I came to Namibia was 52 years ago. I think all of you were not even born then, so you know how old I am. It was on my honeymoon, and I spent 3 months in Namibia in those days, 1972. It was a very different country, but already in those days, a very beautiful country. So Namibia is always very close to my heart, and I have been here many times in between to visit this beautiful piece of country. So, but for the whole visit is overshadowed by the passing away of your president, and on behalf of the entire Merck Foundation, I would like to extend our deepest condolences to the people of Namibia on the passing away of His Excellency Hage Geingob. His long political work and his very successful time as president of Namibia touched many lives, and his enduring memory will always be in our hearts. This is a moment of profound sadness for the nation, and our thoughts and prayers are with you during this difficult time. One of the reasons, of course, as Dr. Rasha already mentioned, was to pay a visit of condolences to our long-term partner and our dear friend, Her Excellency Monica GEINGOS, the former First Lady of Namibia, who we met yesterday. As you all know, through our partnership with the former First Lady of Namibia, we have been working together to transform the patient care landscape and build healthcare capacity in the public sector in Namibia since 2020. I'm proud to share with you that since 2020, the Merck Foundation has provided more than 68 scholarships of 1-year online PG diploma and 2-year master degree for local doctors in several underserved and critical medical specialties in Namibia, such as, just to mention a few, fertility, embryology, oncology, preventive care, cardiovascular, diabetes, and so on. It's a long line of names where we could train some specialists. The objective of this program is to contribute to building healthcare capacity in the public sector with the aim to establish a strong platform of skilled and specialized healthcare providers across Namibia's public health sector. And I think we are on our way to do this, together with you. Our aim is to improve the overall health and well-being of people by building healthcare capacity across Africa, Asia, and some other developing countries. So we are strongly committed to transforming the patient landscape through our scholarship programs. We strongly believe that empowering people will lead to a better future, and we also believe good healthcare can transform the lives of individuals and families across developing countries. It can significantly contribute to economic and social development. This is also a very important point. Healthcare is a major driver of economic growth and consequently of social progress. We all know that the lack of financial means is not the only challenge in Africa. The scarcity of trained healthcare personnel capable to tackle diseases and prevention and diagnosis and management at all levels of the healthcare system is the biggest challenge. The sweeping shortage of medical and healthcare manpower in many countries worldwide has been a crucial limiting factor. A WHO report from 2017 points out that Africa had just 168 medical schools in the entire continent. Out of this, just 1 medical school in 24 countries and no medical school in 11 countries. Sub-Saharan Africa, with 24% of the world's disease burden, has only 2.8 healthcare workers per 10,000 capita. This is compounded by the maldistribution of workforce between urban and rural areas and the public and the private sector. For example, before the start of the Merck Foundation programs in 2012, there was not a single oncologist, fertility or reproductive care specialist, diabetologist in countries like the Gambia, Liberia, Sierra Leone, Central African Republic, Guinea, Burundi, Niger, Chad, Ethiopia, Myanmar, Bangladesh, and Namibia as well. We have either very limited specialized doctors in many fields or none. So this has been changing over the years. Together with our local partners, Merck Foundation continues the efforts in transforming the patient landscape through our Merck Foundation Partnership Program. Till today, more than 1,730 scholarships have been provided for young doctors from 52 countries in 42 critical and underserved medical specialties. Many of them are becoming the first specialists in their respective countries, also here in Namibia. So, dear partners and alumni, I am glad to meet you today here and to hear from you all, hear your feedback, your success stories, and your experience gained from these training and educational programs, and, very important, your subsequent work in the country, in the fields. I congratulate you all. I know many of you have already graduated, and the rest are undergoing their scholarships successfully. We appreciate that you are taking your studies very serious, as it will significantly contribute not only towards your own future career, but also towards the quality of your practice in the country. But it will also further contribute to improve patient access to equitable and quality healthcare in Namibia. Today we are also meeting and recognizing the 26 winners of the Merck Foundation Awards since 2020. So sorry, the pandemic, of course, left a big gap in the years. Anyhow, we are catching up now, and a very good number we will see. So well done. I'm very proud of all of you, because there's always an effort behind it. We at Merck Foundation strongly believe in the critical role that media and art plays to create a cultural shift and to address all social and healthcare issues in your communities. I'm sure that all of you know, as our social and health champions, that you can and will make a change. Be the voice of the voiceless and educate the communities about various social issues in Namibia. Social issues such as supporting girl education, breaking infertility stigma, ending child marriage, ending GBV, stopping FGM, and health issues such as diabetes and hypertension prevention. Promote healthy lifestyle, and, ladies and gentlemen, as part of our enduring Linda program, together with the former First Lady, we have provided scholarships for 20 schoolgirls who are high-performing but underprivileged to cover their school fees, uniforms, and related items. These initiatives is to support them, help them to continue their school education, to reach their potential and fulfill their dream of a good education and a better life. Dear Merck Foundation alumni, I would like to acknowledge your role as healthcare champions in your communities and to acknowledge your collaboration with our media recognition winners, who are also Merck Foundation alumni like yourself, to help them to sensitize community members and separate myth from fact, hence raise awareness about different critical and sensitive social and health issues in a scientific and ethical way. Let's all work together to transform patient care landscape in Namibia and, of course, across the African continent. Thank you very much for listening.